We have a 48-year-old male with a history of hypertension, hypertension, hyperlipidemia, coming in with ongoing cough and shortness of breath after an extremely long plane ride around the Earth 3 times, should say 3x. He is found to be tachycardic and his age-adjusted D-dimer is elevated. You are rotating in the ER. What score can you use to determine if the patient requires inpatient admission? Is it the Wells score, the simplified PESI, the PERC, the Hestia score, revised Geneva, or I don't know most of these? So I want you to select one of them. I'll give you 20 seconds and commit to an answer. All right, and as Dr. Chuang has reported, this is a very timely topic based on today's morning report. So the answer to this specific question is actually the Hestia score. So today we're going to talk about pulmonary clinical calculators and in mostly broad strokes. So the risk calculators actually help you answer two different things. The first is, does the patient have a PE? And for that, you would use the Wells, revised Geneva, or the PERC. And how severe is the PE? So you'd use the PESI, the simplified PESI, or what is known as the Hestia score. So the PERC and Hestia are in red because if you get a score of 0 with either of those, it makes the pretest probability extremely low for PE or extremely low for high severity PE. So let's actually go over the inputs required for scoring. So the first one is, does the patient have a PE? So if you look at the Wells score, it's actually all history. Maybe there's a little bit of heart rate in there too. Revised Geneva uses history and heart rate. The PERC uses history, heart rate, and O2 sat. So you can actually use any of these clinical calculators once you get the history and you get a set of vitals. I think it's important to note here that the D-dimer is not in any of these calculators. So unlike today's morning report, if you don't have a D-dimer, but you have this information, apply the risk calculator first before getting the D-dimer. Like I said, the PERC is in red because if the score is 0 and your gestalt pretest probability is less than 15%, the likelihood of PE is very, very low. Okay. So let's pivot now and ask how severe is the PE and go over some of those risk calculators. And so we have these parameters again. If you look at the PESI, the PE severity index, you use the history and a whole set of vitals. With the simplified PESI, it's a history and fewer vitals. And if you look at the Hestia, it's history, some vitals, and then the platelet count, creatinine clearance, and the INR. If the Hestia score is 0, the PE can likely be managed as an outpatient. So this is analogous to the utility of the PERC score for does the patient have a PE? Notice how there's no troponin, EKG, or TTE in any of these. And so it goes to show you that these risk calculators help you to a degree, and then you have to augment that with additional information. So I think that's pretty interesting. So let's go over the Hestia score very quickly, and not the components. All of you know how to MD calc, but it's helpful in ruling out a PE that requires admission. And so validated in China, it's 500 patients. It was found to have a sensitivity of 82% and a specificity of 56%. The reason I give you this number is if you have a Hestia score of 0, we are saying that, hey, you can be managed as an outpatient that only has a sensitivity of 82%. It's what we've got, so that's what we should use. So I encourage all of you to use the Hestia score more. One component of the Hestia score is the fact that they have severe liver impairment, and they actually leave it up to the clinician to decide what that means. Some consensus shows that it is actually, people will use coagulopathy, an INR greater than 1.7, or thrombocytopenia, a platelet count of less than 50. So markers of liver dysfunction. I didn't see anything about the use of albumin, however, you probably can use that as well. So let's go over this again conceptually. So within PE clinical calculators, you can ask one of two questions. Does the patient have a PE, or how severe is the PE? Realize that with the Wells, revised Geneva, or PERC, you can answer the question, does the patient have a PE? And if you use the PESI, simplified PESI, or Hestia, you can ask yourself, how severe is the PE? Please realize that calculators are only as good as your clinical suspicion. So if you get a PERC of 0, but you're still worried, keep going. If you have a Hestia of 0, but you're worried, admit them and treat the PE. These are not perfect. remember that history, vitals, and then a couple of labs, creatinine clearance, platelet count, and INR will actually allow you to use all these calculators. So this is a really good exercise to do, especially when you're rotating in the ER. Finally, realize that the D-dimer, the troponin, the EKG, and TTE are all absent in these calculators. That's it. What questions do you all have?
I think Reza might have put his hand up in the Zoom.
No, I was just applauding. Thanks, Daniel.
All right. Stay tuned for, no, next week we are not having this because it is Thanksgiving. So we'll be back the week after. Thanks, everybody.